Shalom, welcome to our Cultural Awareness Project. Today in a few quick video clips we tried to portray what an Orthodox Jewish patient experiences in the hospital setting. The patient is admitted to the hospital and the admission nurse learns that the patient is an Orthodox Jew. The caregivers at the hospital are culturally aware of the Jewish law that prohibits a man and a woman from any physical contact, even if one of them is ill. They assign the patient a female nurse and doctor in order to accommodate their religious practices. The admission nurse also contacts the dietary team to put in orders for a kosher diet. The scene begins with a 15-year-old female patient suffering from cystic fibrosis.
Hey Megan, I have your patient in room 4 and I was wondering if I could have a report.
Okay, the patient is Rachel Goldberg. She's a 15-year-old who has diagnosed with cystic fibrosis. She had a flare-up overnight. She has crackles, shortness of breath, wheezing. She's on oxygen. She's Orthodox Jewish, and her father's requested not to have eye contact and that the patient's on a kosher diet.
Okay. I'll make sure patient's wishes are all met when I do my assessment on her. Okay, perfect. Hi, Ms. Goldberg. I'm Jenna. I'm your nurse. Can you tell me your full name and date of birth?
Rachel Goldberg, May 30th, 2000.
Okay. How you doing?
I'm okay.
Yeah. How you feeling? What's your pain?
I'm in a lot of pain.
Excuse me, nurse. I prefer not to be part of this.
Okay.
This is not culturally sensitive for me.
Okay, that's fine. You can
I'll be
step out
back
of the room.
later.
All right. We'll let you know what's going on. All right. So what's your pain?
It's about a 9.
All right. Have you taken any pain medications lately?
No.
Are you allowed to take any pain medications? Is she allowed? Yes. Okay. I'll look after my assessment. I'll get you your pain medication.
Okay.
So right now I'm just going to do a quick assessment. I'm just going to listen to her lungs. The overnight nurse told me what was going on. So, yeah, just run down that. Is there anything you'd like me to know right now before I start the assessment?
No.
Okay. So if you help her sit up, I'm going to start by listening to her heart. Okay, is your oxygen okay? If you take in a couple deep breaths, I'm going to listen to your lung sounds now. Okay, take a deep breath. Okay, take another one. And another. Alright, I'm hearing, you can sit back down. I'm hearing some crackles, but I'm just going to check your skin right now. See how you're doing. Alright, good capillary refill. Your skin feels a little dry. Do you want any water? Okay, I'll leave some here at the bedside for you.
Thank you.
I'll take care of it. Okay. I'm going to go report back to the doctor, and then we'll see how you're doing after that.
Thank you.
Thank you.
What you just saw was the father leaving the room due to cultural restrictions. He's not allowed to be present while his daughter is being assessed. The nurse has gone to give report to the physician and will also confirm pain medication orders for the patient. Orthodox Jews only accept medication if it is for pain.
Hey, Dr. Bryce, just assessed my patient in room 4. I received a report this morning that overnight her health declined rapidly, but I just want to let you know that during my assessment, the patient reported her pain 9 out of 10, and I just heard bilateral crackles, and she was having difficulty breathing, and she was also dehydrated, so I left water by her bedside.
Okay, well, I'm going to go in and see her now, but we should definitely keep a close eye on her.
I agree.
Help, my bubula! She's not breathing.
Call Blue!
All efforts were made to resuscitate the patient. However, Rachel Goldberg died shortly after. Once time of death is confirmed, no one can touch the body for 20 minutes. Once the time is up, the Jewish Burial Society comes to carry the death rituals out for the family. All tubes should be knotted as close to the site as possible. Cut above the knot and taped down in place. Urinary catheters may be removed and discarded. No bandages or wound dressing should be removed. The eyes are closed and the body is laid and covered with the hands open and palms to the ceiling. Close the mouth, but if the mouth remains open, then the chin should be tied with a bandage or towel around the head, or one may place a prop such as a rolled towel under the chin. Candles are lit next to the body, and place a candle near the head. The windows will be open to symbolically assist the departed soul on its ascent heavenward. Mourners also pour out the water that is present in the room down the drain. For we shall surely die and be as water spilled. Water is thought to act as a barrier against the spiritual forces that accompany death, and it is sometimes spilled alongside the body itself, as Jewish custom for mourners to also cover their mirrors, to remind a mourner to look to others for sympathy and not to expect to be a tower of self-reliance and strength. Some have the custom to lower the body to the floor. The body and head should be covered with a sheet. If the body gets unrobed, the peri area must be covered by a sheet at all times. The body would be positioned so that the feet would face the door. The body is never left alone until after burial as a sign of respect. The people who sit with the dead body are called shamarin, meaning guards or keepers. The shamarin may not eat, drink, smoke, sing, play music, or perform a commandment in the presence of the dead as a respect for the dead. To do so would be considered mocking the dead because the dead can no longer do these things. Autopsies in general are discouraged as desecration of the body. They are permitted, however, where it may save a life or where local law requires it.